A speech disorder is a condition that makes it difficult to produce speech sounds or to speak fluently. It affects the way a person forms words and sentences, making it hard for others to understand them. Speech disorders can range from mild difficulties to severe impairments, and they can affect people of all ages. A speech disorder is any condition that affects a person's ability to produce sounds that create words. Damage to muscles, nerves, and vocal structures can cause it. Examples include stuttering and ataxia. Speech is one of the main ways in which people communicate their thoughts, feelings, and ideas with others. The act of speaking requires the precise coordination of multiple body parts, including the head, neck, chest, and abdomen. In this article, we explore what speech disorders are and the different types. We also cover the symptoms, causes, diagnosis, and treatment of speech disorders. Speech disorders affect a person's ability to form the sounds that allow them to communicate with other people. They are not the same as language disorders. Speech disorders prevent people from forming correct speech sounds, while language disorders affect a person's ability to learn words or understand what others say to them. However, both speech and language disorders can make it more difficult for a person to express their thoughts and feelings to others. Speech disorders can affect people of all ages. Some types of speech disorder include stuttering, apraxia, and dysarthria. We discuss each of these types below. Stuttering refers to a speech disorder that interrupts the flow of speech. People who stutter can experience the following types of disruption. Repetitions occur when people involuntarily repeat sounds, vowels, or words. Blocks happen when people know what they want to say but have difficulty making the necessary speech sounds. Blocks may cause someone to feel as though their words are stuck. Prolongations refer to the stretching or drawing out of particular sounds or words. The symptoms of stuttering can vary depending on the situation. Stress, excitement, or frustration can cause stuttering to become more severe. Some people may also find that certain words or sounds can make a stutter more pronounced. Stuttering can cause both behavioral and physical symptoms that occur at the same time. These can include tension in the face and shoulders, rapid blinking, lip tremors, clenched fists, sudden head movements. There are two main types of stuttering. Developmental stuttering affects young children who are still learning speech and language skills. Genetic factors significantly increase a person's likelihood of developing this type of stutter. Neurogenic stuttering occurs when damage to the brain prevents proper coordination between the different regions of the brain that play a role in speech. Apraxia. The brain controls every single action that people make, including speaking. Most of the brain's involvement in speech is unconscious and automatic. When someone decides to speak, the brain sends signals to the different structures of the body that work together to produce speech. The brain instructs these structures how and when to move to form the appropriate sounds. For example, these speech signals open or close the vocal cords, move the tongue and shape the lips, and control the movement of air through the throat and mouth. Apraxia is a general term referring to brain damage that impairs a person's motor skills, and it can affect any part of the body. Apraxia of speech, or verbal apraxia, refers specifically to the impairment of motor skills that affect an individual's ability to form the sounds of speech correctly, even when they know which words they want to say. Dysarthria. Dysarthria occurs when damage to the brain causes muscle weakness in a person's face, lips, tongue, throat, or chest. Muscle weakness in these parts of the body can make speaking very difficult. People who have dysarthria may experience the following symptoms: slurred speech, mumbling, speaking too slowly or too quickly, soft or quiet speech, difficulty moving the mouth or tongue. The symptoms of speech disorders vary widely depending on the cause and severity of the disorder. People can develop multiple speech disorders with different symptoms. People with one or more speech disorders may experience the following symptoms: repeating or prolonging sounds, distorting sounds, adding sounds or syllables to words, rearranging syllables, having difficulty pronouncing words correctly, struggling to say the correct word or sound, speaking with a hoarse or raspy voice, speaking very softly. A speech-language pathologist, SLP, is a healthcare professional who specializes in speech and language disorders. An SLP will evaluate a person for groups of symptoms that indicate one type of speech disorder. To make an accurate diagnosis, SLPs need to rule out other speech and language disorders and medical conditions. An SLP will review a person's medical and family history. They will also examine how a person moves their lips, jaw, and tongue and may inspect the muscles of the mouth and throat. Other methods of evaluating speech disorders include Denver Articulation Screening Examination. This test evaluates the clarity of a person's pronunciation. Prosody Voice Screening Profile. SLPs use this test to examine multiple aspects of a person's speech, including pitch, phrasing, speech patterns, and speaking volume. Dynamic Evaluation of Motor Speech Skills, DEMS, Manual. The DEMS is a comprehensive guide for helping SLPs diagnose speech disorders. The type of treatment will typically depend on the severity of the speech disorder and its underlying cause. Treatment options can include speech therapy exercises that focus on building familiarity with certain words or sounds. Physical exercises that focus on strengthening the muscles that produce speech sounds. We discuss some of the treatment options for speech disorders below. Target selection involves a person practicing specific sounds or words to familiarize themselves with particular speech patterns. Examples of therapy targets may include difficult words or sounds that trigger speech disruptions. Contextual utilization. For this approach, SLPs teach people to recognize speech sounds in different syllable-based contexts. Contrast therapy involves saying word pairs that contain one or more different speech sounds. An example word pair might be beat and feet or do and show. Oral motor therapy. The oral motor therapy approach focuses on improving muscle strength, motor control, and breath control. These exercises can help people develop fluency, which produces smoother speech that sounds more natural. Ear devices are small electronic aids that fit inside the ear canal. These devices can help improve fluency in people who have a stutter. Some ear devices replay altered versions of the wearer's voice to make it seem as though someone else is speaking with them. Other ear devices produce a noise that helps control stuttering. Medication. Some speech disorders can cause people to develop anxiety disorders. Stressful situations can trigger anxiety, resulting in more pronounced speech disorder symptoms. Anxiety medications may help reduce symptoms of speech disorders in some people. Speech disorders affect a person's ability to produce sounds that create words. They are not the same as language disorders, which make it more difficult for people to learn words or understand what others are saying to them. Types of speech disorder include stuttering, apraxia, and dysarthria. There are many possible causes of speech disorders, including muscles weakness, brain injuries, degenerative diseases, autism, and hearing loss. Speech disorders can affect a person's self-esteem and their overall quality of life. However, speech therapy, breathing exercises, and, sometimes, anti-anxiety medications can help improve speech and reduce symptoms. Types of speech disorders. Articulation disorders, trouble producing specific speech sounds, like substituting one sound for another. Phonological disorders, problems with the sound system of a language, including how sounds are organized and used. Fluency disorders, interruptions in the flow of speech, such as stuttering. Voice disorders, problems with the quality, pitch, or loudness of the voice. Childhood apraxia of speech, a motor speech disorder where the brain struggles to coordinate the movements needed for speech. Dysarthria, a motor speech disorder that affects the muscles used for speech, causing slurred or slow speech. Aphasia, a language disorder, not a speech disorder, that results from brain damage and affects speaking, understanding, reading, and writing. Causes of speech disorders. Speech disorders can arise from various factors, including organic causes, physical or neurological issues like hearing loss, developmental delays, neurological disorders, cleft palate, or other structural abnormalities. Functional causes, difficulties in speech production or sound system use without a clear physical cause. Other influences, genetic disorders, illness, and environmental factors like limited language exposure can also play a role. Symptoms of speech disorders. Symptoms vary depending on the specific disorder, but can include difficulty pronouncing certain sounds, stuttering or other fluency issues, slurred or slow speech, limited vocabulary or difficulty finding the right words, challenges understanding spoken or written language, hoarseness or other voice quality issues. Diagnosis and treatment. Diagnosis. Speech-language pathologists use various tests and assessments to diagnose speech disorders. Treatment. Speech therapy is the primary treatment for most speech disorders. Therapy focuses on improving speech production, fluency, and communication skills. Medical and/or surgical interventions may also be needed in some cases. Importance of early intervention. Early diagnosis and treatment of speech disorders are crucial for optimal outcomes. Speech therapy can significantly improve a child's communication skills and overall development. Speech disorders, impairments, or impediments, are a type of communication disorder in which normal speech is disrupted. This can mean fluency disorders like stuttering and cluttering. Someone who is unable to speak due to a speech disorder is considered mute. Speech skills are vital to social relationships and learning, and delays or disorders in developing these skills can impact individuals' function. For many children and adolescents, this can present as issues with academics. Speech disorders affect roughly 11.5% of the U.S. population, and 5% of the primary school population. Speech is a complex process that requires precise timing, nerve, and muscle control, and as a result is susceptible to impairments. A person who has a stroke, an accident, or birth defect may have speech and language problems. Classification. There are 3 different levels of classification when determining the magnitude and type of a speech disorder and the proper treatment or therapy. Sounds the patient can produce. Phonemic, can be produced easily, used meaningfully and constructively. Phonetic, produced only upon request, not used consistently, meaningfully, or constructively, not used in connected speech. Stimulate sounds. Easily stimulated. Stimulate after demonstration and probing, i.e. with a tongue depressor. Cannot produce the sound. Cannot be produced voluntarily. No production ever observed. Types of disorder. Apraxia of speech may result from stroke or progressive illness, and involves inconsistent production of speech sounds and rearranging of sounds in a word. Potato may become topato and next totopo. Production of words becomes more difficult with effort, but common phrases may sometimes be spoken spontaneously without effort. Cluttering, a speech and fluency disorder characterized primarily by a rapid rate of speech, which makes speech difficult to understand. Developmental verbal dyspraxia, also known as childhood apraxia of speech. Dysarthria is a weakness or paralysis of speech muscles caused by damage to the nerves or brain. Dysarthria is often caused by strokes, Parkinson's disease, ALS, head or neck injuries, surgical accident, or cerebral palsy. Dysprosody is an extremely rare neurological speech disorder. It is characterized by alterations in intensity, in the timing of utterance segments, and in rhythm, cadence, and intonation of words. The changes to the duration, the fundamental frequency, and the intensity of tonic and atonic syllables of the sentences spoken, deprive an individual's particular speech of its characteristics. The cause of dysprosody is usually associated with neurological pathologies such as brain vascular accidents, cranioencephalic traumatisms, and brain tumors. Lisps. Muteness is the complete inability to speak. Speech sound disorders involve difficulty in producing specific speech sounds, most often certain consonants, such as /s/ or /r/, and are subdivided into articulation disorders, also called phonetic disorders, and phonemic disorders. Articulation disorders are characterized by difficulty learning to produce sounds physically. Phonemic disorders are characterized by difficulty in learning the sound distinctions of a language, so that one sound may be used in place of many. However, it is not uncommon for a single person to have a mixed speech sound disorder with both phonemic and phonetic components. Stuttering, aka dysphemia, affects approximately 1% of the adult population. Voice disorders are impairments, often physical, that involve the function of the larynx or vocal resonance. Causes. In some cases, the cause is unknown. However, there are various known causes of speech impairments, such as hearing loss, neurological disorders, brain injury, an increase in mental strain, constant bullying, intellectual disability, substance use disorder, physical impairments such as cleft lip and palate, and vocal abuse or misuse. After strokes, there is known to be a higher incidence of apraxia of speech, which is a disorder affecting neurological pathways involved with speech. Poor motor function is also suggested to be highly associated with speech disorders, especially in children. Hereditary causes have also been suggested, as many times children of individuals with speech disorders will develop them as well. 20 to 40% individuals with a family history of a specific language impairment are likely to be diagnosed, whereas only 4% of the population overall is likely to be diagnosed. There are also language disorders that are known to be genetic, such as hereditary ataxia, which can cause slow and unclear speech. Many of these types of disorders can be treated by speech therapy, but others require medical attention by a doctor in phoniatrics. Other treatments include correction of organic conditions and psychotherapy. In the United States, school-age children with a speech disorder are often placed in special education programs. Children who struggle to learn to talk often experience persistent communication difficulties in addition to academic struggles. More than 700,000 of the students served in the public schools' special education programs in the 2000 to 2001 school year were categorized as having a speech or language impairment. This estimate does not include children who have speech and language impairments secondary to other conditions such as deafness. Many school districts provide the students with speech therapy during school hours, although extended day and summer services may be appropriate under certain circumstances. Patients will be treated in teams, depending on the type of disorder they have. A team can include speech, language pathologists, specialists, family doctors, teachers, and family members. Social effects. Having a speech disorder can have negative social effects, especially among young children. Those with a speech disorder can be targets of bullying because of their disorder. This bullying can result in decreased self-esteem. Religion and culture also play a large role in the social effects of speech disorders. For example, in many African countries like Kenya, cleft palates are largely considered to be caused by a curse from God. This can cause people with cleft palates to not receive care in early childhood, and end in rejection from society. For those with speech disorders, listeners' reactions are often negative, which may correlate negative effects to self-esteem. It has also been shown that adults tend to view individuals with stutters in more negative ways than those without them. Language disorders. Language disorders are usually considered distinct from speech disorders, although they are often used synonymously. Speech disorders refer to problems in producing the sounds of speech or with the quality of voice, where language disorders are usually an impairment of either understanding words or being able to use words and do not have to do with speech production. Thank you for watching this video.